Hello. Even if you're wrong, it's okay. I'm not giving any marks.
Sir, we ask the patient to extend the hands and
No, so I have to see.
Ayo.
You. Anybody, if you don't mind, that's what I said. It's not a compulsion. Boys, Gansham from KIMS. Gansham from KIMS. Alekia from Gandhi Medical College. Lakshmi Kishore. Can anyone show? Otherwise, I'll show here. Please, I want to see someone doing even a wrong way. No problem. Gansham from KIMS. Open karo. Open your video. Rahim from Shadan.
Yes, sir.
Yeah. Chalo, open your video. Show me how flapping tremors look like.
I don't know, sir.
You don't know. Okay, very good. Sadaf. और कौन है? Alekia from Gandhi. Do you know Alekia? Okay, I'll show you without wasting time. Can you see them? Can you see me? Yes, ask the patient to hold the hands like that. Usually, our student flapping tremors, they do like that. This is not flapping tremors. Ask the patient to extend both the elbows and the wrists. Can you see that?
Yes.
Elbows or like this. Extend the elbow, extend the wrist maximum, and ask them to keep it like that for a minute. So the extended wrist position cannot be maintained for a long time in patients with chronic liver failure. So they tend to fall. They tend to fall and they try to keep it back. So it appears like this. All the patients do like that. Both the hands together. So they cannot keep the wrist extended for a long time. They keep falling, they try to correct it. So this is called flapping tremor. For that you have to keep the hand. So this is possible only patient when he cooperates with you, not in hepatic coma. In grade 4 of hepatic encephalopathy, so patient will not understand, he will be not in a position to do that. Again, in grade 1 hepatic encephalopathy, grade 1 hepatic encephalopathy, you won't appreciate these flapping tremors. So it is only grade 2 and grade 3. So that is flapping tremors. Somebody answered right. Okay, we'll go back to him.
Yes.
Okay, what else? Jaundice is over, abdominal pain is over, vomiting, ascites. Hypogonadism. This was the answer I was waiting. Who did that? Oh, you. Oh, Arbaz, very good. Hypogonadism is not the answer, not the word. What you mean is right. What you said is wrong. It's not hypogonadism. It is testicular atrophy. Hypogonadism is a hormonal defect. So testicular atrophy. Again, the same reason why somebody has gynecomastia. So if you have to see, you have to examine the patient, examine their axillary hair, chest hair, pubic hair, and the size of the testes. They have small testes, and they also have secondary infertility if they are young. Infertility. So because of the small testes, they cannot produce children if they are still in the child producing age.
That is irreversible.
Huh?
Irreversible.
That is irreversible. Yeah, these are all the signs of chronic hepatic failure, chronic hepatocellular this failure. They are reversible. They are part of the cirrhosis or part of the hepatocellular carcinoma. Okay. What are the diseases, common diseases that we come across liver? What are the common diseases? Very common disease is jaundice. Jaundice, we have hepatitis A, B, C, D, and E. I requested one of my colleagues to talk on this jaundice, various types. Probably in a couple of days, he'll come and talk, Dr. Vidyasagar. So he is the right person to talk. But today we'll just briefly say a few words about jaundice. Jaundice is a very common disease, hepatitis. What are the causes of jaundice? Usually it is a viral infection, A, V, and when some viruses were detected about 25 years back, which are not looking like A, which are not looking like B, we used to call them non-A, non-B viral hepatitis. But again, we named it as C. So we also have D, we also have E. D is nothing but a different form of B only. So all the A, B, C, D, all are RNA viruses except hepatitis B is a DNA virus. That's the difference. And actually, really speaking, like contrary to popular belief, the viruses don't cause the disease actually. It is the host response that causes the disease. Viruses are innocent, they are poor, they don't cause the damage to us. When they attack us, we overreact, our immune system overreacts, that causes the disease picture. Signs, symptoms, fever, this, that is only because of the host response of inflammation. The viruses per se don't cause any disease. You remember this. Many books don't give this important point. So, what does a patient come to you with? Like, suppose somebody has a hepatitis. What are the complaints? What are the complaints? What are the symptoms? Fever, very good. Afsa, fever, very good. Yes, go on typing. Pain, okay, very good. Fever, pain, jaundice, itching. Yeah, fever, yellowish skin, itching. So this bilirubin has a special liking towards the certain tissue, like where elastic tissue is present, like your sclera, and skin has got a lot of elastic tissue. So wherever elastic tissue is there, the bilirubin gets attracted. That's why your sclera looks yellow. But by the time the jaundice appears, the patient usually fever subsides and usually they become less contagious to others. But we are really afraid of going to a patient of jaundice, a patient of jaundice. But in the course of hepatitis, when the jaundice appears, by that time the patient, 1 or 2 weeks, the patient become less infective to others. Many people are not aware. You general people are not aware of this fact. So these are the various types of jaundice. What are the complications of jaundice? Usually, type hepatitis A is self-limiting disease. We don't need any specific treatment. They can present with jaundice, vomiting, pain, abdomen. They need complete rest, good fluids, good nutrition, rest. They don't need any treatment. Hepatitis B is a different, the routes of transmission are different from, so Dr. Vidyasagar will talk everything about that. So complications are, again, complication, it can cause multi-organ failure, it can cause shock, it can cause septic shock, it can cause hepatic encephalopathy, it can cause hepatic, it can cause hepatorenal syndrome, hepatopulmonary syndrome. These are the complications that the liver disease patients can come with. Some people with jaundice, they become chronic hepatitis patients. Some people, that is complication. Acute hepatitis can go into chronic hepatitis, and chronic hepatitis go into hepatocellular carcinoma or even your cirrhosis of the liver.